Okay, hello everybody. Thank you for attending our webinar today. It's our online class of Immigrants Health Coverage, Public Charge Specific Provisions and Exceptions. And I will try to do as much Chinese as possible. I know a lot of people are here because you're either immigrants from Asia or from different continents. So I just want to be as international as possible, catering to our clientele. So in Chinese, I will explain the topic of our webinar. So it is called 移民健康保险公共负担的特殊规定和例外情况. So I will be the host. I am Angel Pale from EPIA Insurance, and thank you again for coming to our online class. Thank you for the overwhelming response for our last online class, and thanks again for attending this one. So 非常感谢大家今天的参加，我是裴应琪权威保险。那么今天呢，和我们的一起合作的伙伴Marcelo 律师，那一起来讨论这个话题。Okay, next page. All right, so this is our English flyer. This is Marcelo Godin, our immigration attorney that we work with, and we are so honored to have him with us today. And I will introduce him after I talk about the little snippet that we have right here showing the different topics that we're going to be talking about. So we're going to be talking about public charge and health insurance affordability programs, cover California, eligibility for financial assistance, public charge impact on people seeking public benefits, the travel ban due to COVID-19, impact of the 2020 election, immigration, and cases processing times due to pandemic. So with that said, I'm going to show the Chinese flyer too for our Chinese speaking audience. 移民健康保险公共负担特殊规定和例外的情况。我们今天合作的律师呢是我们的 Marcelo Godin， 然后他是我们的合作伙伴。那今天如果大家有任何的移民方面的问题呢，都可以咨询他。今天我们的话题就是在公共负担和健康保险负担能力的计划，加州全保Cover California 获得经济补助的资格，公共负担对寻求公共福利的人们的影响。另外呢，还有因为新冠病毒禁止旅行的一些对移民有关系的一些法案，以及2020年大选对移民法有什么样的影响？那以及尤其流行病这个新冠病毒所造成的案件处理之间。所以今天的节目非常的精彩。那我们再看下一页哈 ，next page. Okay, so before we formally introduce Mr. Marcelo Godin, we want to announce that there's an EPIA monthly raffle. Every month, we give a gift for our friends. So how to sign up? If you're already on the webinar, you already signed up. So lucky for you, and thank you for participating. And if you want to tell your friends, we actually have links available on our social media on the last page when we're done with our seminar. So you guys can do that once you can use your phone, turn on the camera, and you can scan the QR code at the very end. So EPIA 每个月呢都有抽奖的活动。今天不管你有没有参加我们这个 webinar， 今天有参加的人呢就自动可以进入这个每个月的活动。那么呢，如果说是你的朋友今天没有来参加的话呢，他也可以在我们的 social media， 比如说网站或者是我脸书等等的呢，都可以来参加这个 raffle。好，那we'll go to next page. So today we're also having a handout. It is a public charge rule handout that we have created with sourcing from reliable sources. It has the applicability and exception of the new public charge rule. So people who are interested, you will be getting an email from us actually, and this is actually for free, whereas people might have to pay for an actual ebook or actual book. We're giving this for free for our clients and our friends. So thank you very much again for attending, and we're going to go to the next page. And Oh, I have to say in Chinese too. 所以我们今天会发派一本免费的 ebook，那就是网上的书籍哈，它是讲那个 public charge 公共负担的这个方面的讯息。所以呢，这个 ebook 是 very valuable 哈，在外面可能要购买才可以有的。那我们今天就是免费给我们所有的观众，那感谢你们来参加我们的网课。以及希望说你能够在这个网课学到一些很适合您使用的东西。那另外呢，我们现在就是要讲一下我们的抽奖。那大家很多人可能对抽奖也蛮有兴趣的哈。那没有关系，我们今天就是有丰富的内容。之后呢，在最后我们会做一个抽奖的活动，我们会选出3位得奖者，然后每一个人呢有一个25块的 gift cards。所以是我们的 cash pricing， 所以感谢你们参加。So in English, I will tell you guys that the $25 gift card is available for 3 people randomly at the very end of the seminar. So we want you to have knowledge. We want you to be feel very fulfilled at the end of the seminar, and also hopefully you guys will win the raffles. So we're going to go to the next page. All right, so for the introduction, first we want to introduce Mr. Godim on providing us with immigration information. I already went through the bullet points, and we will have him start with our first part. So welcome, Marcelo.
Hello, everyone. Welcome to the seminar. Okay.
So you can introduce yourself a little bit, and you can jump right in. And if you have a slides, you could show us the slides too. So I'm gonna mute myself, and it's all you, Marcelo.
Thank you, Angel.
Thank you.
So hi, everyone. My name is Marcelo Gondim. I'm from Brazil originally. I'm an immigration attorney in Orange County, California. And I was invited, and it is to me an honor to be part of this seminar about the public charge rule and the impact on immigrants. There's a lot of information that we're going to provide right now. So I do not have a Chinese version for everything, but
Okay, seems like we lost connection to Mr. Golding, but not to worry, he's right here. He came back. So let's unmute you, and you can continue talking.
okay. So I apologize. I might have had some. Okay, I need to get permission to share the screen.
So Marcelo has been an immigration lawyer for a long time. He actually solved a lot of issues and very knowledgeable in the public charge rule. And I enjoyed talking with him every single time we have an issue, or maybe we have a question from our insurance clients, and we always refer our questions to him. So we thank you for your professionalism, and let's start on your slides when you're ready.
You're welcome, Angel. So here is how we prepare condensed information about the public charge rule and how that may or may not affect you. So the meaning of public charge. So public charge previously was considered to be an individual who is or is likely to be dependent on any kind of public financial aid to complement his or her income or live under the government's expenses for a while. Now the new public charge rule will consider a public charge a non-citizen who receives certain types of public benefits for more than 12 months in a total within any 36-month period. In the new rule that the Department of Homeland Security is going to apply now, It's going to be applied by consular officers, which is for people applying for a green card or some non-immigrant visas from abroad. So they're going to also use this rule. And there are certain factors that the officer of the immigration service or consular officer, they're going to use to determine whether or not the person is a public charge or is more likely to become a public charge. And the main factors are the age, the health, the family status, any assets and resources that the person may have, the financial status, the level of education and skills. So those are things that may imply that someone may or may not become a public charge. So if the person is older, they are considered more likely to become a public charge because they are less likely to be employed and have a reasonable income. Also, the health conditions, a person with extreme health conditions versus a person who is still healthy. So those are factors that also might be considered. The family status, of course, a person who has significant family members, say families with 5, 6, 7 people, they might be considered more likely to become a public charge because of the size of the family. And assets and resources, of course, if the person has assets, financial status is good income, good ability to make money, level of education, this is also considered. So none of these factors will be considered alone. It's all the totality of the circumstances. So everything will be taken into consideration, and they're going to have their own formula to calculate, the likelihood of someone becoming a public charge. The DHS, the Department of Homeland Security, will consider public charge the SSI, Social Security Insurance, Social Security Income, the TANF, SNAP. We can provide a list of those things in detail, but just for the purpose of this presentation, we're going to go over this. Those are fairly difficult to be for someone who's a non-citizen to have these benefits anyway, but let's go over. So Section 8, housing assistance. If you live in some kind of community that has some kind of subsidies by the government, if it's Section 8 housing, then you might have a problem with a public charge, and Medicaid and some others. We can provide a full list, but those are the most important that we can discuss right now. Note also that before, when I said it's 12 months of public charge in any 36-month period. So if you have 2 benefits in the same month, they might be considered as 2 months of benefits. So it's not, if you have 3, 4 benefits and you just use them for 1 month, they're going to be considered as 3 and 4 months of benefits. So be aware of that too. The rule is not retroactive, but even if you use that in the past, if you use those benefits in the past, and it was before February 24th, 2020, when the rule became effective. So if you use benefit before that, they cannot be considered directly, but they can also be considered as a negative factor when they're going to balance out all the circumstances to establish whether or not you might become a public charge. There are some exceptions to the rule of public charge in terms of the Medicaid benefits. So treatment for an emergency medical condition are not considered as an exception to the Medicaid rule. Also, individuals under the Disabilities Education Act, some school services for students below the secondary level of education, individuals under the age of 21, so they are not considered a public charge if they use the benefits, even though they are non-citizens, and women during the pregnancy and up to 60-day period after delivery. So those are exceptions to the Medicaid, not to the public charge rule as a whole. I'm just talking about the Medicaid exception to the public charge rule. Other exceptions to the public charge rule are military services or dependents, non-immigrant visa categories such as the U and T. The U immigrant non-immigrant category is for people who are victims of crimes. So that's the U non-immigrant status, and then after you can get your green card. So there's also an exception for the majority of children who will receive automatic citizenship after admitted as immigrants. Normally, if you petition a child who is living abroad as a U.S. citizen, if you've been a U.S. citizen and you apply for a child to get them the green card, once they come here, they automatically can become citizens upon immigration. So they're not going to even have the period of being a resident. They're going to come and become citizen right away. So those are also exceptions. And also have CHIP and WIC. So those are California. The first one is California. The second one is national, but the state of California also administers this kind of benefits, WIC for formulas or milk for infants and children. And also benefits received before October 15, 2009. That's when the rule first came out. Now, there's a revision to this, and now it's going to be considered February 24, 2020, but I like to leave this there because you know that this is when the rule became, they tried to make this rule become effective. There was extensive litigation, and some federal judges enjoined this rule until it was finally cleared to start on February 24, 2020. So the receipt of public benefits, they can only be directed, the direct beneficiary of the application will receive the benefits, will be receiving benefits. So you don't get to be considered a public charge if someone in your family applied. It's only you, it's only the applicant. So that's what I'm saying here. So if a relative, if you apply for your child or for your mother or somebody else in your family, you won't be considered a public charge just because you applied for someone else. It's the recipient of the benefit that is going to be considered a public charge. So these are benefits that are not considered a public charge. I'm not going to go through all of these because, as you can see, it's an extensive list. Some of them are not even available, but they're listed in the regulations. So I'm going to just go over the ones that are in highlight because those are the ones that are important to discuss here at this seminar. So unemployment benefits, it's very important to understand that if you lost your job because of COVID, or if you have less hours of a part-time job or something like that, and now you have a loss of income, unemployment benefits are not going to be considered public charge, okay? Because this is an insurance that you pay for. It comes out of a paycheck. So using that insurance and receiving unemployment benefits would not be considered public charge. Also, workers' compensation benefits, not considered to be a public charge. And Medicare, also, it's not a public charge. This is very important, actually, this one for COVID situations. So public health assistance for immunizations, in case they come up with a vaccine, with respect to immunisable diseases and for testing and treatment of symptoms of communicable diseases. So those are related to COVID and any other communicable disease that might be spreading. So this can be also, this will not be considered public charge. Also, many people ask this question, attending public schools. Everybody has the right to put their children in public schools, and that's not going to be considered a public charge, okay? And the most important, the health insurance through the Affordable Care Act, commonly called Obamacare. So that's not a public charge issue. As a matter of fact, it's actually advisable that you get this kind of insurance because the Trump administration was also fighting to make sure that everybody will have to show some sort of ability to obtain insurance, or they already have insurance, to get a green card. So they lost this battle for now. It's been suspended by the courts, but they're trying to make sure that everybody has health insurance. So not only it's not a public charge, it's also extremely advisable that you get your health insurance through the Affordable Care Act. Even if there's a subsidy that you're not paying full premium because the government's helping you, it's not considered a public charge, and we encourage you to go ahead and get your insurance. And the tax credits. So the stimulus checks that many people received during the pandemic, and now there's another wave of checks being sent out by the Treasury Department. Those are not indication of public charge. They are outside the rule because they are tax credits. They are not public benefits, okay? So this is basically the very summarized explanation, but the most important topics are here about the public charge rule. So now I'm going to give it back to Angel, and we might take questions. I guess we have some questions that we're gonna. So, Angel.
Hi, Marcelo. Thank you so much for the informative presentation. So we are very lucky to have Marcelo with us and talking about immigration. He's able to speak English, Spanish, and Portuguese. So, you know, anybody has a question, you guys are welcome to contact him. So with that said, I'm going to continue with the presentation, and our presentation will be mostly focused on the insurance portion of the public charge rule or just for immigration. So my section is going to be separated by individuals, and the last part is going to be companies. So even if you just have a two-person company, you're able to decipher if you guys qualify. And also, once you qualify, what can you do to actually get the insurance coverage as a group? So I'm going to start with immigration status and cover California. So living in California, you guys understand that ever since January 1st of 2014, since Obamacare started, we are to have insurance, otherwise we're going to get a tax penalty. So with that said, if you're an immigrant, a U.S. citizen, a U.S. national, or a non-citizen who's lawfully present is required to purchase health insurance. So the tax penalty varies based on your income and based on your based on your income, a percentage of your income. And so if you are not lawfully present, California is actually very lenient. There's possibilities of you receiving coverage through Medi-Cal. So that part, you guys can go to Cover California's webpage to figure out if you guys qualify for that. So the next page, we're going to talk about the mixed immigration status families. So a lot of families, the parents might not be legal. However, their kids might be born here. So what's going to happen is the head of the household would do the application through Cover California, but their kids are the only ones that could be qualified. So let's say it's a mixed immigration status family. The dad is not an immigrant, but the dad is not a lawfully insured immigrant, but the mom has a green card. The kid has a maybe as American citizen. Then what's going to happen is that when the tax subsidy is calculated, it will only calculate the two people in the family instead of all three people. So the next page, we're going to talk about the getting financial help for Cover California Health Plan. So basically, like what I said, if you are unlawfully present in America, then you are not considered to be part of the financial help. So later on, I'm going to show you the federal poverty level chart to show you how this is being calculated. And with that said, I'm going to look at the next page, talking about verifying immigration status. Okay, so how do we verify? So only those individuals seeking to health insurance coverage through Cover California, either Cover California Health Plan or Medi-Cal will be asked for information to verify their citizenship or lawfully present status, such as a social security number or alien number. So like I said, if it's in the family, you are not applying, then you don't have to supply all those information. So a lot of people wonder, is Cover California connected to the Immigration Office or Homeland Security? The answer is no. It is information secure and private, and Cover California does not share any information to immigration agencies. Okay, so next page, please. So verifying immigration status. We already talked about that. But yes, definitely you can show your social security number or alien number. If you have a US citizen child, you have to show their birth certificates. The information is actually checked electronically through the Social Security Administration or through the Department of Homeland Security. So if the information is not verified, then the applicant has 90 days to actually supply this information directly to your Cover California enroller or directly online. Next page. So again, Cover California will protect your privacy. They will not share your information with the immigration offices. Next page, please. All right. So we have some scenarios. Scenario 1, an individual who is lawful temporarily resident with a work or student visa who wants to receive health insurance coverage through Cover California. So this person is especially if it's a lawful temporary resident and they have plans either to become a permanent resident or a citizen, then this person would they can apply for premium assistance or cost sharing subsidies. They must attest to their household income for a year that they want to cover. So let's say if you want to have insurance in 2020, then because we don't know what you're going to be reporting in 2020, however, you would have to do an estimate based on your current income in order to find out how much you'll be making in 2020. So it is especially difficult right now with the COVID-19. No one's job is actually secured. So it is very important that you do as close of an estimate as possible. And if you feel like you will not be working or will not have a job for a while, then first of all, this is besides the insurance point, you should look into EDD for unemployment coverage benefits. And that could also be considered as part of the determination of how you get your Cover California subsidy. So for more information, every individual is different. I would advise that you talk to your insurance agent or get opinions from us for free. So next page, we have the scenario 2. A parent who is not lawfully present and wants to apply for health insurance coverage through Cover California for his or her lawfully present children. So we talked about it a little bit earlier that if the Social Security or the other immigration status verification documents, the person completing the application is not required to apply to enroll, let's say, the kids. So only the child needs to provide the proof. So, but because the child's a minor, we still need a head of household or somebody to help apply for the kid. So that's an answer for scenario 2. But obviously, like I said, everyone has a different situation. And for more information, you can talk to your agent. Next page. Okay, so we do have a lot of new immigrants that come in that has their own insurance already. So scenario 3 is talking about an individual that has foreign health insurance coverage through a US-based employer, but lives in California for an extended period of time. So the answer to this one is health coverage provided by a foreign insurance issuer to foreign nationals lawfully present in the United States for an extended period of time that is not offered within a state in the United States is not considered minimum essential coverage, MEC. So if your coverage is not minimum essential coverage, MEC, then your insurance cannot be replaced, cannot replace the coverage here in California, which means your insurance is not good enough to fulfill the insurance rule in California, which means that you will still get a tax penalty if you report taxes. So it's very important that if you live in California for an extended period of time, that you try to apply for insurance within California, either through Cover California, or you buy it individually from the insurance company, or you would apply through the company structure. So that's like a small group or a large group, or have your company here in the United States give you insurance coverage. So all of this, I'm talking about health insurance. So if you have any health insurance questions or issues, please talk to your agent or consult us for free. So next page, please. All right, so this is the federal poverty level chart that I was talking about earlier. So if we want to look at the household size, so we're just going to assume that it's an individual. So one person in the first column. If you are a one-person, single person, if your income is between 138% to 600%, you might be eligible for Cover California subsidies. So what that means is it's a sliding scale. If you are to make more, your subsidy will be less. If you are to make less, your subsidy will be more. So what happens if your income is between 0 to 138? That means you will be in the Medi-Cal portion. So if you guys look at the bottom purple part, it says Medi-Cal for adults. So that part is 0 to 138%. So this is your adjusted gross income, which most likely will be your tax form, the first page, the 1040, the last item on your tax 1040 first page. So once you look at that number from your last year, you'll be able to maybe gauge your this year, how much you'll be making this year. All right, so at 138%, one person, your income should be around 17,000, and we would say it's better if it's at 18,000 or more, because you don't want to be risking your coverage to accidentally go into the Medi-Cal situation. So, and also if you guys want to look at the chart in the last page, you know what, we'll just talk about this page, because that last page you'll be able to find out on Cover California. If you go to coverca.com, you'll be able to search for that page, and it's called the FPL. So F like a federal, P like poverty, L like level. So as we are searching for our next page, I just want to present a little bit in Chinese, that if you go to Cover California, they also have Chinese information. 在 Cover California 的网站上面呢，也有中文的 information， 所以你们可以到网站上面去查更多中文的讯息。那我等一下会给你们看一下，就是我在这个网上呢有一些讯息可以给你们看到。那目前来讲说 Cover California 它上面不只有中文，它还有不同的语言，所以今天如果你身边有任何的朋友，可以把握现在的机会哈，在最后这个7月的几天呢，我们趁现在还有一个 special extended period 的时候，可以在上面申请保险。那当然这些是给目前还没有保险的人，或者是说失去工作的人，他们可以用失去工作这个特别的情况去申请保险。So again, this is the FPL form, and if you guys have any other questions, we can definitely talk about it offline, but talk to your agent if you feel like you might qualify for a very good subsidy. So this Chinese page, we're just gonna stay here. I'm just showing you that there's Chinese information on Cover California. So we can go to the next page. And it tells you what is HMO, what is PPO, what is EPO. Due to time constraint, we're not going to go into details on that right now because I feel like if you have insurance, you probably heard of these things. HMO is, you have to commit to a family doctor, a medical group, but PPO is you have more freedom seeing the doctor that you want directly. EPO is similar situation as PPO. However, you might or might not be able to go out of the network. So next page. So this is the page, if you guys want to take a screenshot for the Chinese of the Cover California. Next page, please. All right, so now we're going to talk about immigrant insurance as a company owner. So first of all, before we start, I just want to make sure that everyone understands that you have to be in good immigration standing in order to set up a company. So hopefully everyone knows that. And once you are a company, what does the insurance company ask for? So other than your basic information of who you are, your social, your driver's license even, they would ask for the statement of information from your company. So basically stating the stockholders of the company and EIN number from the IRS. So you need to have the EIN number in order to start a company medical insurance plan. So good standing with the state, making sure you are not, a criminal or, having bad business practices. And some of the coverages need DE9C, basically your quarterly wage report that you send to the EDD showing your payroll every quarter. So those are the information, that basic information that's needed to set up a company insurance regardless of your immigration status. However, you have to be in good standings. Okay, next page. All right, so this part, we're gonna show you some promotions from some of the carriers. So some of the carriers, I'm not gonna name them. If I accidentally put their names down, just ignore it. We're not here to promote insurance companies, we're just here to share information. So earlier I was saying that some insurance companies, they might need DE9C, some might not need it. So this is one company that might or might not need it based on how many people you have. So the first bullet point is the DE9C is not required if you have 5 or more employees enrolled. And the second part is that if you have a copy of a prior carrier bill from a previous carriage, that is required. And if you're a startup group or a virgin group that has never had insurance, then or union or non-union or groups leaving a PEO are not eligible. So those are for special qualification categories that would need DE9C. So DE9C, again, is your quarterly wage report, may be requested for groups with employees over 65 years old. So we have to make sure that there's reasons why you are employing someone at a retirement age. So the last bullet point is if a group is enrolling with out-of-state employees, then company-wide payroll may be requested to confirm that 51% of your employees are in California. Next page. All right, so some insurance companies, they care about participation. So one of the insurance companies, they are having a promotion where only 25% of the employees on your payroll need to enroll with this insurance company. So not everybody, not all full-time employees have to enroll, only 25%. So that gives the insurer, the clients, employers, a lot of flexibility on who's going to be enrolling, who's not, and applies to specialty products such as dental, vision, life, other than medical. And you could also pair this carrier, this insurance company, with another carrier. And the last part is healthcare exchanges are not eligible for this promotion. So this insurance carrier actually participates in the Cover California group plans So if you were to choose the plan from that category, then it's not, this promotion doesn't apply. So next page. All right, so what about startups? What if you just want to start a company right now? So the startups need to sign and complete conditions of enrollment forms. So you got to have really complete enrollment forms. Business documentation obviously is required. Everything I was stating, the statement of information, EIN number, etc. And payroll is not required because you're a brand new company. So they're being super lenient. They said that, hey, you can just enroll, but you got to provide your first 30-day of payroll within the 45 days after your effective date. So for example, it's July right now. So if you want an August effective date, then by the middle of September, you will have to provide your August through September payroll to the insurance company in order for them to continuously cover you under their plan. So that's really lenient because other insurance companies, they need like previous 30 days or previous 60 days of payroll in order to enroll you. So this is a really great promotion for startups. So next is an existing group that has just hired their first W-2 qualifies as a startup, including sole proprietors and partnerships. So it's a lot of possibilities. It doesn't matter how big your company is, big or small. You are also welcome to explore the option of a company medical insurance. Next. All right, so owners only. So if all your employees are all owners, then we'll accept the insurance company will accept owner-only groups as long as the group's business entity is a type of corporation such as LLC, S Corp, or a C Corp. So at least 2 eligible owners are required. So you have to have at least 2 people to be a group. Next. All right, so some groups are husband and wife. Some people think that, you know, husband and wife, they're the best partners, they're partners for life, so why not start a business? So before Obamacare, that's actually widely practiced. However, after Obamacare, that is not being promoted a lot. Before, there's only one insurance company, but now we have 2 that accept husband and wife companies. So this company will accept husband and wife as long as both are not owners. And one of the spouses must be a W-2 employee on the payroll and not an owner. And the group cannot be a sole proprietor or partnership. And group must be on an S Corp, C Corp, and an LLC. So if you do qualify, or if you have more questions, you're welcome to talk to us or talk to your insurance agent. Next page. All right, so a lot of people have common ownership concerns, you know, percentage of ownership, and also bigger companies, they might consider PEO. Basically, they have leased employees, but they do want to cover them for insurance. How do they work with that if the employees are not on their payroll? Also, if these employees have to be on the W-2, or can they cover 1099? And individual as a valid waiver, if they have Cover California, or if they have other individual insurance, would that be a valid waiver of not joining the company? These are questions to be explored. So I just want to bring that out, that if you're a company, obviously, other than making the company profitable, you should also think about these ways of applying for company medical insurance, not only to have insurance, not only to fulfill maybe your immigration status or needs, but also as a tax write-off. So we have some CPAs here today, but I just want to make sure that you talk to your tax advisor and let them know that you're interested in getting a medical insurance plan. And with that said, you will be able to write off most of your insurance premiums and also some of the expenses. So it's a great way for the company to leap onto the next step. All right, so now we're gonna have the question and answer, and I think all the questions today are for Marcelo. So I don't know if Marcelo will be able to answer these questions. Marcelo?
Hi there. So let's go.
Yes.
Thank you, Angel.
Yes, you
So,
can run the show.
no problem. My
Yes.
pleasure. It's a
Okay.
great presentation, by the way.
Thank
So,
you. You as well.
number one, who's not subject to the public charge ground of inadmissibility? So people applying for naturalization, for example, so they are already residents and applying for naturalization, they are not subject to the public charge rule. Also, um, people who already have their green cards are not subject to this rule, so they can use the benefits normally. It's the public charge rule would apply to people who are applying to get a green card. So applying to get permanent resident status. So they have to show that after they become a resident, they're not going to become a public charge. So in this case, people already applying for naturalization, of course, they're already residents, or people who are already residents, even if they're not applying for naturalization. So they are not subject to this rule. Of course, this rule is not going to be, and also it's very important to understand certain things. Depending on how the election goes, this public charge rule might be, revoked altogether. Okay, so of course, if the current president wins re-election, this might continue for a while. There might be some other challenges in federal courts that might change or revoke the whole thing in the future, but right now it's going to continue. And if it doesn't get elected, it's very unlikely that the new president is going to keep this public charge rule. So I'm not trying to be a non-partisan here, but it is a fact. So let's go for the next question. Yeah, so this question is interesting. It kind of was already responded on the previous question, but anyway, so the person is asking, I am a lawful permanent resident, also called LPR, that's the acronym for this. So, and I have a green card. Will benefits I receive while in LPR status or as a resident affect my application for citizenship? No, it's not going to affect. The public charge rule is not going to affect people who are already permanent residents or people who are applying for naturalization. Next question, please. So can a public charge determination be retroactive? Well, so here is what's confusing about this whole thing. The public charge rule will be based on benefits acquired before, after February 24th, 2020. Okay. However, even though they cannot apply this retroactively, it's still, they might consider some of the factors as a negative factor to determine if the person is going to become a public charge or not. But does not automatically give the person the public. What is the impact? Question number 4, what's the impact on non-immigrants? Some non-immigrants might also establish that they're not going to become a public charge. So it just goes in most cases as if they're applying for permanent resident status as well. So they have to show, based on all the totality of the circumstances and the factors that we outlined in my presentation, okay, that the person is not going to be a public charge. So non-immigrants have to establish that too. Okay, so now that's the follow-up. Angel?
Okay. So thank you, Marcelo, for all the answering. I wonder if you guys have any other questions. Let's see. We have a Q&A coming. We have a question from Joanne. Do the companies need to be registered in California for employees to qualify? For instance, LLC based in another state doing business in California. Thank you. So this is a question about insurance. Or is this question for Marcelo? Oh, insurance. Okay. All right. Yes. So thank you, Joanne, for the question. I just want to repeat the question again. Let me see if I can answer. Okay. So all right. Oh wait, sorry. Eunice, can you please type your question? I accidentally deleted. So please, Eunice, type your question again. Thank you. All right, so I'm gonna answer Joanne's question. So Joanne, if your company is located somewhere else, we need to see your company document. So like we mentioned that the document, let's say statement of information, is called a different name at every single state. So it basically, it's a domestic stock of corporation. So it shows who actually owns the company. So every state has their own. And if your documentation is in that another state, then you will be applying from that state. It doesn't matter if you're doing business in another state. So another thing is what you have to think about is how many are your majority employees. If you have majority of employees in, let's say Texas, then and you have maybe another sub company of the same name, satellite company located in California. Let's say Texas, you have 51 people, and then California you have 49. Then we would be applying for insurance in Texas. So you will be working with an agent that is licensed in Texas, which we are also. So that'll be something that you can consider. However, if you have multiple locations, then we can look at your total census based on how many employees you have at several different states. Then we could help you find the best rates to see which state is the most appropriate for you. So the next question, Eunice. Eunice, does the public charge rule apply to people who adjust status based on asylum?
No, it's not going to apply to these people, just like the EU visa. So asylum is a very special class of immigrants. They are not required to show that they're not going to be a public charge. They are probably fleeing some illegal persecution in their home countries, and they're afraid to go back. So they won't be affected by the public charge rule.
Okay, great, thank you. Yeah, I think that's all the questions. So before we go into the raffle, we're actually right on time. We have a few more minutes until noon. So we will email all your employees a copy of the PPT, your class recording, and also the handouts that we were talking about in the beginning, the booklet for the public charge. And you guys will be getting that in your email shortly. So with that said, let's go to the next page. All right, so well, we're going to have an Auqust Events. August, we're going to have also at the end of the month a monthly raffle. We're also going to have a webinar August 25th at 11 a.m. It's about commercial insurance, protection for your business, and hot topics. Basically, it'll be most likely about COVID-19 again. A lot of people are trying to claim a business income, business interruption insurance, which is the same thing. And maybe no success, they have to talk to lawyers. But what we're saying is that, it's a really common thing that insurance is not covering a lot of COVID-19 related damages due to how big of a scale it is. So with that said, hopefully you guys can join us August 25th, mark your calendar at 11. So next page. All right, so thank you. And here are the QR codes I want you guys to scan and follow in order to join our raffle. So we have, first of all, it's our website. The second one is our WeChat, Facebook, YouTube, and then Instagram. So any information or question, please email us at info@epiagroup.com. Phone number 626-912-1988. And the website, again, is www.epiagroup.com. All right, so let's do the raffle. Thank you so much for participating, and you guys all deserve to win, but we only have 3 winners. Okay, so we collected all the names of the attendees. Sunny Zhang. Congratulations, Sunny, for winning the $25 raffle. We're gonna pick 2 more. Kevin Tao. Congratulations, Kevin, for winning the raffle. Freya Chow. Freya, congratulations for winning the raffle. Please tell your friends. All right, so with that said, our online class is coming to an end. Again, we thank you, Marcelo. And Marcelo, do you want to tell us your name of the company and also your phone number or website again?
Sure, it's Gondim Law Corp. We are on the web at www.gondimlaw.com. And the phone number here is 714-733-1277.
Got it. Thank you so much, Marcelo, for attending and also giving us such a valuable information. And thank you for all the attendees for attending, and congratulations on the winners. So we'll see you on August, in August. Talk to you soon. Bye-bye.